Patients with COVID-19 will soon be getting the antiviral, but does it work? Favilavir was originally developed to treat nose and throat inflammation. China says it's tested the drug on 70 patients with the virus, but Canadian doctors say it's impossible to know whether it helped.
It's an uncontrolled trial, so they gave this drug to a bunch of people. It's not a drug that was intended for this use. They say the people got better, but they may have gotten better anyway.
Similarly, 2 other medications have been tried outside of China. An Ebola drug was given to an American man who fully recovered, and a patient in South Korea improved after using a drug combo for HIV. China has now launched more than 80 trials testing different treatments. The World Health Organization is trying to structure some of those trials so that the data meets a certain criteria. But scientists here at home are doing testing of their own.
That's part of our Infectious Disease Association in Canada that's actually trying to set up trials before this hits Canada so that we'll actually be able to make meaningful observations about whether or not these drugs work or don't work.
Inside the hospital that treated Canada's first case of COVID-19, Dr. Samira Mubaraka is trying to figure out what parts of the virus to try and target with antivirals and vaccines.
This has been a blistering pace, I have to say.
Antiviral drugs are given to people who are already infected to stop the virus from multiplying. Vaccines prevent people from getting infected in the first place.
So essentially it boosts the immune system in a very specific way that actually allows the host to fight off the virus before it can even start an infection.
So it's a very important area of discovery.
The WHO is also considering hyperimmune globulin therapy, which involves taking antibodies from the blood of a patient who's recovered from COVID-19 and giving them to a sick person.
It just gives the new patient's immune system a vital push at the time it needs it. But it has to be carefully timed, and it's not always successful.
Scientists will only be able to declare complete success if they have treatments to fight COVID-19 and a vaccine to prevent it. Both will take time. Christine Burak, CBC News, Toronto.